9 natural remedies to get rid of urinary incontinence, including olive oil and cinnamon. Content: 1. Urinary incontinence causes and treatment. 2. Possible causes of the problem of enuresis. 3. Treat incontinence naturally. Incontinence is a problem associated with childhood, as 1/4 of children in the world suffer from urinary incontinence or urination during sleep, and this condition often celebrates with children when their bladder grows and grows better, and also, incontinence affects adults. Research indicates that it occurs for about 1 or 2% of adults, but this number may be greater than that, as there are many adults who may feel embarrassed to talk to the doctor about this problem. If you were exposed once or two to urinary incontinence and you were an adult, there is nothing to worry about, but it does happen frequently. It means that there is a problem, and you must talk to the doctor. So through this article we will learn about what is urinary incontinence, its causes, and ways to naturally treat it. Urinary incontinence causes and treatment. Possible causes of the problem of enuresis. 1. Hormonal problems. Anti-urination hormones send signals to the kidneys in order to stop urine production, and your body produces more of that hormone during the night in order to prepare you for sleep, and this helps to reduce the number of times you enter the bathroom during sleep. However, in some people, this hormone may not be produced adequately or their bodies may not respond well to it. Therefore, abnormalities in the anti-urination hormone play a role in the occurrence of urinary incontinence, although there are different theories that suggest that several causes must be combined for this to occur. The problem. A problem with the anti-urination hormone, difficulty in waking up and sleeping, in addition to bladder problems during the day, may lead to incontinence. The level of the anti-urination hormone in the blood can be measured. If it is too low, the doctor will prescribe the drug. 2. Small bladder. A small bladder does not mean that the size of the bladder is smaller than the rest of the bladder, but rather it means that it is full at a few levels, which means that it works as if it is small in size, and this means the feeling of the need to urinate many times, including controlling a small bladder may be a hindrance to bedtime and may lead to incontinence. Bladder training may be an effective way for those who suffer from a small bladder, as this method helps the body withstand urine for a longer period. 3. The very active muscles. The detrusor muscles are the muscles of the bladder that relax when the bladder is full and contract when it is emptied, and if the contraction of that muscle occurs at the wrong time, you may not be able to control urination, and this condition is called a very active bladder. These abnormal contractions may occur in the bladder muscles as a result of abnormalities in the nerve signals between the brain and the bladder, or as a result of the presence of inflammation, irritation of the bladder due to caffeine or taking some medications. 4. Cancer. The presence of tumors in the bladder and prostate may impair the urinary system, which leads to the inability to tolerate urine, especially at night. The diagnosis of cancer requires physical examinations, in addition to some CT scans, and a biopsy must be taken from the tumor to determine whether it is a tumor or not. Cancer treatment may help eliminate or shrink the tumor, which may prevent incontinence. 5. Diabetes. Having diabetes and the inability to control blood levels may contribute to changes in urination, so when the blood sugar level is high, the amount of urine increases due to the kidney's attempt to control sugar levels, and this may lead to an increase in the amount of urine more. From 3 liters a day, it may lead to incontinence. The treatment of diabetes often contributes to reducing these symptoms. 6. Sleep apnea. One study found that about 7% of sleep apnea sufferers suffer from urinary incontinence. 7. Taking medications. Some medications may increase the frequency of urination and lead to any increase in the constriction of the bladder, which may lead to incontinence. 8. Genetic factors. The problem of urinary incontinence is often passed on between generations, and it is not clear yet what gene causes the transmission of this health condition, but if you have one of the parents with urinary incontinence, then you will most likely suffer from it as well. 9. Neurological impairment. Some of the following neurological disorders may lead to impaired bladder control, which includes multiple sclerosis, epileptic seizures, Parkinson's disease. Treating urinary incontinence naturally. After knowing the causes of urinary incontinence, there are some natural ways that you can treat this problem, including 1. Cinnamon powder. One of the simplest home remedies for enuresis is cinnamon powder. 1 stick of cinnamon may be consumed once a day, or cinnamon powder can be added to food. 2. Eating the Indian amla plant. This fruit is used in the treatment of many diseases, including incontinence, where you can grind the pulp of the amla plant and add it to a large tablespoon of honey with a handful of turmeric powder and eat it in the morning daily. You can also eat amla plant with black pepper. Night. 3. Olive oil. The best way to treat urinary incontinence is olive oil. Just heat some olive oil and put it on the lower part of the stomach while it is warm and rub the area gently for several minutes a day. 4. Drink herbal tea. You can make herbal tea from horsetail, oak bark, and berries for the treatment of incontinence. You can mix small amounts of these ingredients and leave them to boil and leave them in the water for several hours, then filter the mixture and eat it twice daily. 5. Cranberry juice. Cranberry juice is an amazing treatment for the bladder, urinary system, and kidneys. 6. Walnuts and raisins. Both raisins and walnuts can be eaten for the treatment of incontinence. Just eat 1 tablespoon of raisins and 2 spoons of walnuts at night. 7. Honey. Honey, which contains natural sugar, may be used to treat urinary incontinence. Just take 1 tablespoon of it daily before going to sleep. 8. Apple cider vinegar. Apple cider vinegar helps reduce stomach acid and thus reduces the need to go to the bathroom frequently. Just put 2 large tablespoons of apple cider vinegar in a cup of water and drink it daily before every meal. 9. Mustard powder. Mustard seeds and powder are one of the strongest remedies for people who suffer from problems with urination. Just put half a small spoon of mustard powder in warm milk and eat it daily.